Hi, my name is Bethany. I'm going to be talking about a skin disease called hidradenitis suppurativa. I'm actually going to start with a quote from someone who lives with it. As someone diagnosed with a chronic disease, I struggle with minor daily tasks. I strain over things that should be easy. I stress knowing that I have so much to do, and I know much of it I will not be able to even start. This disease has had me feeling the most vulnerable I've ever felt in my life. About 1 to 4% of the population has hidradenitis suppurativa. However, HS is often misdiagnosed and that number can be lower or higher. Hidradenitis suppurativa, HS for short, is a chronic inflammatory skin disease involving the hair follicles and sweat glands. Also known as acne inversa, this condition usually begins with the appearance of pimple-like bumps on the skin. Without treatments, these bumps can worsen, grow deep into the skin, and turn into painful, hard lumps or pocket of pus, or in other words, boils and abscesses. The pockets often break open and drain, and after they heal, thick scars often form. This disease has a profound impact on quality of life. HS is classified into 3 stages called Hurley staging. Hurley staging is used for medical professionals to assign a level of severity. It doesn't account for the disease activity, pain level, or quality of life impact. Stage 1 is single or multiple abscesses without sinus tract formation, and that's tunneling or scarring, and stage 1 is the most common among people who have HS. Stage 2 is recurrent abscesses with 1 or more sinus tracts and scarring widely separated by normal skin. And stage 3 is multiple sinus tracts and there is no intervening normal skin. Hidradenitis suppurativa can appear anywhere on the body that grows hair. The only part HS doesn't affect is the palms of the hands and the soles of the feet. However, the most common areas affected are where the skin rubs together, such as armpits, inner thighs, underneath the breasts, the buttocks, growing area, back of the neck, and hairline, and the ears. The exact cause of HS is unknown, but the immune system does play a role. People without inflammatory conditions such as HS have balanced amounts of specific inflammatory proteins produced by the immune system. With HS, the body produces too much inflammatory proteins. The imbalance leads to increased inflammation throughout the body. Increased inflammation affects deep layers of the skin, causing pressure. This pressure builds to become abscesses, which may be painful and eventually rupture, and this cycle continues, and that's why this skin condition is chronic. HS isn't contagious. It isn't caused by poor hygiene. It has nothing to do with showering or shaving. It is not an STD. This disease is not preventable or curable. Due to this disease not having a cure, there are treatments available to help manage this lifelong disease. The treatments with medication or surgery or both can help control symptoms and prevent complications. No single option has been proven to be completely reliable, but research continues to determine the best combination. Medications prescribed are antibiotics cream, which are topical, and that means that they apply onto the skin directly, and those fight infections. And then antibiotics taken by mouth, when they are prescribed, they're usually on them 2 to 6 months before a checkup. Otherwise, they're on that antibiotic up to a year or 2 years. And then pain medication is also prescribed if over-the-counter doesn't work. There are surgeries that are most common with HS is incision and drainage, and that means that if the abscess fills with too much pus and it doesn't drain on its own, they'll cut it open and drain it. And surgical removal of the affected skin. So if you have abscesses under your armpits, they'll take out your armpit, or they'll take out the tissue that's affected, and then they usually use a skin graft to close it up. This skin disease is not as rare as it sounds, but what is frustrating about it is that there are not a lot of people, let alone doctors, that do not know about this disease or are educated about it. I think it's important to talk or inform about this disease to raise awareness.
Thank you.